Hi, my name is Joe Ebner. I'm the Chief Medical Officer at Speare Memorial Hospital in Plymouth, New Hampshire. I want to welcome you today to this COVID-19 update geared towards the citizens of Central New Hampshire. We are now 8 months into this journey, and I know that all of us have been affected by COVID-19. Our daily routines have been disrupted both at home and at work. Many of us had vacations that were postponed or canceled. Major life events, birthdays, weddings, anniversary celebrations have been put on hold. I know that for many of us, we had to work remotely, had to school remotely, and then we're back at work or back at school, but it's a very different feel than when we left last February. But I do want to applaud you, our community, for your adherence to the public health guidelines that bent the curve back in May and allowed us to have a fairly good summer with very little local COVID-19. In particular, I'd like to commend the school officials, whether they're presidents, principals, superintendents, headmasters, the staff and the teachers, the paraprofessionals, all the teams that went into keeping our children safe. You should be commended for the work that you've done this summer and fall to balance safety for our children and your co-workers with in-person learning. But this current situation for New Hampshire is sobering. This week, we marked over 15,000 New Hampshire cases since the beginning of the pandemic. We also experienced our over 500 New Hampshire deaths since the beginning of the pandemic. There have been nearly 1,000 New Hampshire residents hospitalized, and currently there's about 100 in the hospital across the state. We are seeing substantial spread of COVID-19 throughout all of New Hampshire. However, we are not powerless. We have learned a lot about this disease since it first hit the world stage just after Christmas time in 2020. The first approach remains prevention. As most of you know, today the governor has implemented a statewide mask requirement. This is to help reduce the spread in public places, both inside and out. And masking has been shown to decrease the spread of the COVID-19 virus. It's also important that you maintain your social distance, 6 feet apart, or wear a mask. It remains important to wash your hands, either with soap and water for 30 seconds or with a Purell type hand sanitizer. It's also recommended to avoid large crowds and crowded places. The next part of our attack on this virus is testing. And there has been a lot that we've done with testing since I last talked to you mid-summer. The testing that we're utilizing in our community tests for viral evidence within the nasal passages. If you have no symptoms and you are interested in testing, let's say you're planning an upcoming trip that you can't avoid, or maybe someone has to come to your home that you're concerned about and you want to test prior to their arrival. This is a nasal swab looking for evidence of the DNA from the virus within your nasal passage. It takes about 3 to 5 days to get that result back. If you're having symptoms, again, it's a nasal swab. This, however, is done in a rapid fashion, and so you find out the result within 15 to 30 minutes. If you're interested in the rapid testing, please call either Mid-State Health Center at 536-4000 or their Bristol office at 744-6200. That number is on the screen. Again, this is for symptomatic testing. Alternatively, if you have symptoms of COVID-19, you can request same-day testing through spearehospital.com. That website is also on the screen. A representative from Speare will contact you shortly after filling out the required information for your rapid test. If you are not having symptoms and are interested in the nasal swab, the one that takes 3 to 5 days to return, you may also access that test through filling out the form at the spearehospital.com website. Insurance does cover this testing, but please call your insurance company first so you're not surprised by any co-pays or deductibles you might need to meet. If you do not have insurance, the state is covering the cost of this testing. The symptoms of COVID-19 include fever, cough, shortness of breath, body aches, chills, fatigue, headache, diarrhea, and this one's unusual, a loss of sense of taste or smell. If those symptoms are not attributable to another cause, it is worth considering being tested for COVID-19. If it turns out your test is positive and that you indeed have COVID-19, you will be asked to isolate at home. Stay at home. Clean the frequently touched surfaces so not to spread to other members of the household. Consider isolating yourself within your home. Stay well hydrated. Check your temperature twice a day. Use Tylenol for aches, pains, and a fever above 101. We also recommend you consider purchasing a pulse oximeter. These are available at many drugstores. They run between $10 and $20. You can also order them online. Pulse oximetry is a way that you can monitor your ventilation status, your respiration status at home, and communicate to your physician how you're doing. Also consider the following medications if you're at home with mild COVID symptoms. Because this disease can cause blood clots, it is encouraged to take a baby aspirin once a day. If you have any questions about how this might affect your other medications, please call your provider. The other things that you can do to boost your immune system is to take a supplement of vitamin D and zinc. Vitamin C can also be taken as it has some anti-inflammatory properties and might help you feel better with COVID-19 symptoms. If you've been diagnosed with COVID-19, please call your physician. You might not need to see them, but that will be your resource for how long you should continue to quarantine and isolate and whether other members of your family might need testing. Certainly, if you develop severe disease, mainly shortness of breath, difficulty breathing, chest pain, please come to the emergency room for emergent treatment. We've also changed a lot in the last couple of months with how we care for patients with COVID-19 within the hospital. We no longer recommend early intubation requiring ICU level of care. The current treatment for COVID-19 requires oxygen at a high flow rate through a nasal cannula or nasal prong in your nostrils. Treatment also includes positioning the patient in a prone or face down position as much as tolerated. There is also an antiviral medication, kind of like an antibiotic but for viruses, called remdesivir, which can be used if you're at high risk for developing severe disease and you're hospitalized. The physicians at the hospital will know whether you're a candidate for that remdesivir or not. Because of the decreased need for intensive care beds, the state continues a collaborative approach to how to care for sick patients with COVID-19. New Hampshire hospitals were ready in the spring, remained ready through the summer, and are ready now for a second surge of patients. We communicate weekly with one another about staffing, medications, equipment, and bed space for our population. At the current time, the New Hampshire Hospital Association and the Department of Health and Human Services feels that we are well prepared for the number of beds and staff needed to care for New Hampshire's citizens should they require hospitalization without the need for an alternate care site. As you may recall, this summer, we created an alternate care site at the Plymouth State University ice rink. At the current time, the Department of Health and Human Services does not feel we will need to stand that up, except for the one that remains in Littleton and the one that remains in Manchester. Probably the most hope I can provide for you today is that we are very close to launching vaccines across the country, across our state, and here in the greater Plymouth community as well. The 5 COVID-19 vaccines are in the process of the approval through the emergency use authorization through the FDA. This is a fast-tracking process that puts the medication to market so that we can safely care for individuals at risk. When I talk to our state epidemiologist, as well as our local pharmacists, to quell your concerns that you might have about the fast-track process, the components that are in the vaccine are similar to other more recently designed vaccines. We believe them to be safe. The virus component within the vaccine will not cause anybody who gets the vaccine to get COVID-19. It turns out, however, that the antigen in the vaccine is the one that's causing a large immune response in patients who've already had COVID-19. This is good news that the vaccine will probably prove to be very effective. In fact, this week Pfizer announced that their vaccine appears to be 95% effective. This is certainly good news and reason for hope. One of the things that the fast track process has required of us is that these vaccines are not stable for storage outside of a freezer situation. The first vaccine that's coming to the New Hampshire will be one that requires temperatures of -70 degrees in a freezer. The state has such freezing capability and will store that vaccine and disseminate it out to the hospitals in the first couple of weeks of December so that we can begin vaccinating our frontline healthcare workers. The second vaccine that will be coming to market shortly thereafter is more stable at a normal freezing temperature and not the super deep freeze. All of these vaccines then have a certain shelf life in the refrigerator and then once thawed to be given to patients. I anticipate that around the time of the holidays, we'll have guidance from the state to begin vaccinating patients at risk for severe complications from COVID-19. And with 3 more vaccines close to market this winter and spring, I anticipate being able to offer widespread community vaccines towards the end of spring in 2021. The New Hampshire Hospital Association, as well as Speare Memorial Hospital, continues to work daily with the Department of Health and Human Services to secure the appropriate amounts of vaccine for healthcare providers, for folks on the front lines, to those at highest risk, and eventually to the greater general population. COVID has been with us now for 8 months. The physician practices, doctors' offices, the emergency room, urgent care, the hospital, dentists, counselor offices, therapy practices have all made significant modifications so that they can provide safe care to you. Some of that care can come through telemedicine, and some of that will have to be face-to-face. Please be assured that the face-to-face appointments are done keeping in mind both you and the provider's safety. Because we know your chronic illnesses did not stop during this pandemic. In other words, some of you still have diabetes, COPD, hypertension, or depression, or a host of other chronic medical illnesses. Please know that your medical community is prepared to care for you. Please do not delay care. Lastly, in this week before Thanksgiving, which will prove to be a very different Thanksgiving than ones most of us have ever had before, let me encourage you to travel less, meet in smaller groups, invite those people that are already in your pod of close contacts over for a holiday meal. And maybe by making less, baking less, we can have less stress on that day as well. Take us some time to be grateful for your health, your family, and your home. Maybe consider starting new traditions. And I want to, at this time, thank the frontline staff, teachers, first responders, nurses, doctors, respiratory therapists, and the other essential workers found in areas of government and grocery stores, and all the others I haven't mentioned specifically. Thank you for what you've done to keep our economy going, to keep your services available for all of us. We do owe all of you a debt of gratitude. On behalf of all of us in healthcare, thank you and have a fantastic Thanksgiving. Be well.